Welcome back, everybody. 40 million people in the U.S. suffer from crushing, head-splitting pain on an almost daily basis. Migraines impact not only their lives, but the lives of their families and friends as well. Please welcome from the Houston Headaches and Migraine Care Center, Dr. Kevin Smith, along with two of his patients, Laura and Dan. All right, Dr. Smith, when we say migraines, a lot of us kind of use it as a generic term to cover all severe headaches.
That's true. That's true, and not all migraines are migraine, which is why I wrote my book, The Migraine Imposter, because it talks about how there are people who are living out there with the diagnosis of migraine who really have another problem, a deviated septum or a bone spur in the nose causing it.
Right, and usually the first thing that happens for a lot of us is that the immediate answer is to get medicated. So was that the first thing that happened with you all? In the beginning, you don't mind because you're like, just get rid of the pain, whatever it takes. Right. But what happened with you and how debilitating were your headaches?
Well, my headache started about 4 years ago. I actually fell off a horse and got a concussion. Ooh. Never had a headache before then, and from there it was just migraines on. Doctor after doctor, the same thing. You just, oh, here, take this medicine, try this shot. As it didn't work, you go to another doctor, and they just...
But it shuts your life down.
Oh, yes. Yes. Yeah, you can't go on vacation without your bags of medicines. You know, ice packs on the head, hard to do work. I'm a active person outside, so, you know, I couldn't ride the horses, couldn't jog, couldn't go fishing with my husband, just nothing.
Yeah, because it wrecks your family life in a sense. I talked to you about earlier in the green room, a friend of mine whose little boy came up to her one day and said, I wish I had a mommy, because half the time she was flat on her back in pain. All right, for you, same battle.
Same battle. I've had them since high school that I can remember. And I mean, I would just keep ice packs in the freezer, and you know, it would just shut down your day if you had these migraines.
Makes it tough when you have a job.
It does.
Because oftentimes people aren't so understanding. For a few, but then after a while it's...
Right, it can happen in the middle of the day while you're at work, or when you've got a plan to go out for the day and have fun, all of a sudden you're shut down.
Yeah. All right. So, Dr. Smith, the important thing to do, which I guess is kind of the fundamental basis of medicine, doesn't always happen, but is to find out cause versus just treat the symptom.
Yes. What I'm trying to do is get people to understand that once you have had a normal MRI of the brain, not to go into the medicine route right away. The next step is to get a CAT scan of the sinuses, to look into the nose, to make sure there's not a problem with the septum, the sinuses, and if there is a problem, get that fixed.
Okay.
And then if you continue to have headaches, then you can go and investigate other problems.
All right, so you have something right here that's an anatomical part. That's right.
This is an actual bone spur that I removed from a patient in surgery that I thought I'd bring in today. And if you can imagine an arrowhead, that's piercing and very sharp on the end of an arrow, this will touch sensitive tissues in the nose. And if it's touching that sensitive tissue, that's what's going to refer pain to the temple, to the forehead, to the brain, you know, that kind of thing.
And shut you down. And there are all kinds of things that can trigger that tissue to even swell a little bit.
Exactly. See, this is a static entity here. It's a fixed point. But they're flexible in erectile tissue in the nose that when you eat, or when you're exposed to allergens, or when you're just outside in the heat, these tissues swell, and that's when you get the contact. The same is true for women who have been diagnosed with menstrual migraines, I believe. You have the hormones raging, you have the water retention, these tissues get swollen, and when you have just a little slight bone spur, that's when they contact, and so once that's all over with after a week, the tissues shrink down, the headache goes away.
Yeah, that's why a lot of people with migraines will, around allergy season, all of a sudden you go, uh-oh, I might get a migraine. Right. They'll tell you to stay away from certain foods, like artificial sweeteners that the body can be allergic to. And so you try all those things, but it's no guarantee. You can't avoid the air, for example.
Exactly.
She also mentioned that she had fallen off of a horse, and that's when it started for her after the concussion. And can you pinpoint when it started for you?
I really can't pinpoint an event. It just seemed to... all of a sudden, I just started getting them mild, and then they got worse over the years. I mean, I've been dealing with them for 30 years.
Wow. All right, so would this be a deviated septum that's the problem, or just different kinds of, just the bone spur in itself?
Well, like you alluded to, a deviated septum comes about with trauma or injury to the nose. You play baseball, you get hit with a soccer ball, you get hit with a bat, you play football, you have a bike accident, you know, a car accident, you hit your nose.
And it doesn't have to be that big of a hit. It could be wrestling with somebody, playing with your kids.
Exactly, and what happens is you jar the nose, the bones in the nose are very, very, very thin, and it gets jarred and you form this bone spur. This is showing an illustration right here in the nose. The septum here in blue is bent and it's actually touching this turbinate. This is the erectile tissue, and when that touches, it's like having, like I said, the arrowhead piercing into the tissue, and that pain then gets referred to the eyes, the forehead, the temples, the cheeks. And so all I do in surgery is I'll go inside the nose, make a little incision above and below this little arrowhead, remove the arrowhead, that relieves the pressure point, and that then alleviates the headache in almost 90% of my patients.
Yeah, all right. So how do you feel now?
Absolutely fantastic. Huh?
You have your life back.
Oh, yes.
I was telling my wife last night, it's been a year that's gone by since the surgery. I have not had a migraine.
Wow. Wow. And so for the 10% of your patients who still deal with some issues with headaches, oftentimes they'll say it's just not as severe or not as often.
Well, it is, that's right. The ones that I have the least amount of success with generally have very, very mild headaches. Sometimes kids too, because they continue to grow, they might have to come back in because I'm very conservative with my treatment.
Right.
So when kids come in with these headaches and they have the deviated septum, I'm very conservative, but they're continuing to grow. So I might have left a little piece in that might grow off and make contact that we have to address later on. But for those 12% that aren't successful with my treatment, again, then I refer them on to the neurologist or other doctors, maybe TMJ.
Yeah. Again, to find the cause.
Right, it could be the eyes, it could be any sort of thing in the head and neck area that can cause these problems.
All right, and let me add, you're also a plastic surgeon, so if you got a little nose problem, you might... Is that a 2-for-1 deal?
Yeah, you can. Generally, patients will come in and they'll get their rhinoplasties done at the same time they get their headaches.
Get a pretty nose and your headache's gone all at the same time.
There you go.
All right. Thank you very much, Dr. Smith. Thank you all, and congratulations on getting your life back, literally. If you want to contact Dr. Smith or find out more about headache treatment, contact his office on the web at HoustonHeadacheCenter.com, HoustonHeadacheCenter.com, or call the center at 281-207-8755, 281-207-8755. Coming up.